So what exactly is bronchial asthma? Why does it occur? Let's start by figuring it out from the very beginning. And then I'll tell you what causes it, what you should do and what you shouldn't do, not just to treat it, but to actually cure it. How can you get rid of those sprays? How can you get rid of these inhalers? Interesting already, isn't it? Because there are people who have cured bronchial asthma and they're even specially called singing asthmatics. Yes, yes, yes. Imagine they started singing, something that's supposed to be impossible with bronchial asthma. So, have I intrigued you enough? Then let's get started. Today, we're going to talk about bronchial asthma. So that we can understand this disease a little better, let's first figure out what the respiratory system is, how it works, how it's structured, the airways that bring in air, and the alveoli where gas exchange takes place. That is, carbon dioxide leaves the blood and enters the air, while oxygen from the air enters the blood. And the main task of the airways is to prepare the air. The air, which is cold, dirty, dry, and contaminated with microorganisms, needs to be prepared and cleaned. For this, there is a mucous membrane in our respiratory system. It's in the bronchi, in the throat, in the trachea, everywhere. And there is an immune system there that disinfects. There is also a network of blood vessels that warms the air. The mucous membrane secretes mucus and humidifies the air. This is the job of the airways, to prepare the air so that, let's say, by the time it reaches the alveoli, it is more or less adapted to the condition of my body. Now look, here's the problem. And here's what the problem is. What else? In our respiratory system, there is a muscular layer. It's internal, meaning there is an outer layer, an inner layer, and the muscular layer is in the middle layer. And the muscular layer of the bronchi themselves are actually rigid. The bronchi contain, and I emphasize this, they contain a cartilaginous base, so the bronchi are more what? Like the throat, cartilage, hard. They're not vessels, they're not like the bile ducts or urinary tracts, which are soft little tubes. They also contain a special rigid cartilaginous base, but still the bronchi in humans also have this muscular framework, the muscular middle layer. And it turns out that the muscular middle layer can also be affected. For every muscle, for any muscle, in order to make the muscle contract, a nerve impulse arrives. Remember this. For a muscle to start contracting, a nerve impulse comes. This is an interesting point. And the muscular layer of the bronchi can also contract, just like blood vessels, causing the opening, the lumen, of the bronchi to narrow. And this condition is called bronchospasm. Bronchospasm occurs due to the spasmodic and involuntary contraction of the smooth muscle fibers that are found within our bronchial tubes, the bronchi. And this bronchospasm, in fact, happens under the influence, naturally, of the autonomic, specifically the nervous system. So the autonomic nervous system can, in certain situations, trigger bronchospasm, as can other factors as well. And now together, we are coming to an understanding. Why does bronchial asthma occur, and what exactly leads to this condition? What is it exactly? How does this process actually happen? Why does bronchospasm occur? In other words, bronchial asthma is when the bronchi are in spasm. Bronchial asthma is when a person wants to inhale, wants to take a breath, to expand their lungs, but because of the spasm of the smooth muscle fibers, the lungs cannot expand. This is what is called bronchospasm. This is what ultimately leads to asthma. Its symptoms. Well, a person wants to inhale, wants to exhale, but can't. Because the mobility of the bronchial system, the mobility of the bronchial tree is hindered due to bronchospasm. But how does it occur? Now that's interesting. Well then, let's get started. Now we'll go through how it develops. Well, essentially it all starts with the fact that the bronchial system very often experiences cooling or contamination. And on the inner wall of our bronchi, on the mucous membrane, an inflammatory process develops. At first it's pharyngitis and laryngitis, then tracheitis and bronchitis. In other words, an inflammatory process. First and foremost, it's a prolonged inflammatory process. And what's most interesting is that this prolonged inflammatory process inevitably leads to the development of allergization in the bronchial system. Pay attention to this word. What is allergization? Let me explain it in simple terms. It means that due to frequent inflammatory processes, an autoimmune response develops, leading to sensitization and increased sensitivity. And then the person's bronchial system within the respiratory tract gradually transforms into a source of an autoimmune process, an autoinflammatory process occurring in the body. In other words, the immune system itself begins to attack the bronchial system, causing autoimmune damage. The essence of bronchial asthma is autoimmune damage. Bronchitis, the kind of bronchitis where evacuation is poor, that's bronchitis. What kinds of bronchial inflammations do we have? There are all sorts. The most diverse types of bronchial conditions, eczema, all kinds of, emphysema, and all sorts of problems with chronic inflammation in the throat or lungs. None of these can be compared to bronchial asthma. Here, it's not just an infection affecting the area, it's specifically the development of an autoimmune process. And this autoimmune process subsequently affects the bronchial system, causing bronchospasm. So it's not an infection, not just inflammation. The infection led to it. But in bronchial asthma, the main pathological factor is the autoimmune process, the immune system attacking its own respiratory system, its own bronchial tree. That's how the mechanism works. And this is where things get very, very interesting, because essentially there are actually two primary contributing factors that are involved in the development of bronchial asthma. There is a factor that, yes, we say causes lung damage in a person. These are frequent, chronic, and inadequately treated chronic diseases, chronic bronchitis. Well, nowadays the diagnosis of bronchitis as such no longer really exists. Essentially, it's chronic obstructive pulmonary disease. Obstruction means blockage. So the bronchial system is constantly affected. And that's the first factor. And this causes bronchitis, it causes obstruction, it causes problems, but it does not cause bronchial asthma. Not all cases of bronchitis lead to bronchial asthma, and not every case of bronchial asthma ends this way. A second factor is needed. And now comes the most interesting part. And the most interesting thing, friends, is the following. The fact is that all autoimmune diseases have one cause, kidneys and adrenal glands that do not function quite properly. The point is that our adrenal glands secrete hormones. They are hormone-producing glands, and the adrenals release hormones like cortisol and various other steroids. They are called steroid hormones. Steroid hormones. These hormones stop inflammatory processes and halt allergies. These hormones also inhibit, let's say, the division of cells in our body. These hormones are the hormones of health, the hormones of stability, the hormones that stop diseases. These are powerful hormones, which is why they are called steroid hormones. With them, the body grows, the body is healthy, the body develops, and the adrenal gland should produce them only in one case, if it receives all the necessary resources for this. For an organ to function, it is essential that it receives a good blood supply, that the blood is rich in oxygen, that it receives proper innervation, and that blood flows out through the veins. There is one more factor. Guys, for an organ to function well, it needs to receive warmth. Hear me out, warmth. What kind of nonsense is Dr. Golod talking about? No, this is not nonsense. Warmth in our body does not spread through the blood vessels or with the blood. Warmth in our body spreads through its own specific channels. These channels are called meridians in Chinese medicine. In other words, according to them, energy moves along the meridians. This warmth, which is produced in our body, in the furnace, the liver, then spreads throughout the body along these same meridian channels as an electromagnetic wave. Yes. How do I know this? Well, in addition to the standard curriculum of our conventional European medicine, I also have some knowledge of Eastern medicine. So, look, to avoid overloading you with this information, let me explain. For the adrenal glands, and by the way, the kidneys, to function well, they need not only blood, immunity, and nerves, but also warmth to reach them. And warmth reaches the kidneys and adrenal glands from the liver through the legs. Just hear this, from the liver through the legs. That is, first the warmth goes into the legs, and then to the kidneys and adrenal glands. And if a person has cold feet, it turns out that the kidneys and adrenal glands don't get enough warmth, and the kidneys can't properly purify the blood. And then bad antigenic contamination of the body occurs. That's a term I came up with myself. This means that the antigenic set, which determines uniqueness during the immune response, is disrupted. And then an autoimmune reaction develops. In other words, my immune system starts attacking its own antigens on the surface of cells because the antigens are slightly altered. Let me show you. The immune system now perceives it as an enemy, as an antenna. And this is the job of the kidneys. But the adrenal gland is supposed to stop this process. But it doesn't produce enough hormones, it produces them poorly, and then an autoallergic process is triggered. Guys, I'm sorry, but the problem is that bronchial asthma is, well, an allergic, it's an autoimmune process. Yes, chronic obstructive pulmonary disease plays a big role there. Infection plays a big role. Long-term illnesses, the disease being in the lungs for many years, yes. But still, the foundation of it all is the formation of an autoimmune process. That's how it is. That's the information. Now look, The reason I dig down to the root cause is because this develops when a person's kidneys and adrenal glands don't function properly from the start, because they don't get enough warmth. Not blood, but warmth, because the person regularly has cold feet. That's how I try to explain everything in simple terms. The root cause of the development of bronchial asthma is that a person has cold feet. I've observed this, looked under the microscope, performed capillaroscopy on thousands of people. Thousands. And in all people with bronchial asthma, I always see the same symptom. They have cold feet. This always matches. It always coincides. And this is what needs to be understood in the process in the context of treating bronchial asthma. We'll talk about this now as well. So how is bronchial asthma treated here? Well, they treat the usual inflammatory processes that occur in the chest, in the bronchial system. And in order to dilate the blood vessels, they give salbutamol, beta mimetics, they use salbutamol. And all the other inhalers that are administered directly into the bronchi are just its analogs. There are all sorts of other agents and medications as well. Even without delving into the essence of this treatment, it is fundamentally incorrect from the start. That is, at the local level, symptomatically, bronchodilators, bronchial expanders are used, and they really do this. But what will prevent the bronchi from spasming again after the effect of the medication wears off, since they become irritated as the inflammatory process develops in the bronchial wall? When the muscular layer is irritated by an autoimmune inflammatory process, that is what causes bronchospasm, that is what forms bronchospasm. That's why all these inhalers, new inhalers, better inhalers, are just treading water and not really addressing the issue. If you want to cure bronchial asthma, you need to act in two directions. First, directly on the organs of the chest cavity. And we all kind of understand this and we all do it, yet there is still no result. What does it mean to act on the organs of the chest cavity? Well, let's not put it off. Right here I have tourmanium ceramic. The very best thing for the respiratory system is tourmanium ceramic. It's a little vest like this. This vest, how does a person put it on? Well, like this probably. The ceramic part goes like this, and the person puts it on the front, puts it on the beat. Yes, it turns out to be a beautiful robe, just like you were thinking. You put it on the front and the back, and it warms up the chest area as much as possible. This helps the respiratory tract do its job. Their job is to warm up the air I breathe in, and also to clean, humidify, and disinfect it. The immune system also benefits from warmth. All 4 points necessary for the respiratory system are fulfilled when I warm up the organs of the chest. This is done in the evenings for hours for a long time. The more the better. This will at least lead to the cessation of the inflammatory process in the chest. But this does not solve the problem of bronchospasms. In that case, you still need to use these medications for a while, including those with bronchodilating effects. But if you want to cure bronchial asthma, you warm up your chest, and that's only the first half. Now for the second half, listen to what I said in the previous section. It all started with your kidneys and adrenal glands not functioning well. And the root cause of this is that you have cold feet. That's why warming up your feet is important. Warming your feet, keeping your feet warm. Cold feet, that's what I'm talking about. This is the cause of autoimmune diseases. This includes multiple sclerosis, Crohn's disease, and ulcerative colitis. This includes rheumatism, autoimmune thyroiditis, and bronchial asthma as well. Cold feet. And that's why you need to warm up your cold feet, but that's not where we start. To keep the genitourinary system functioning, drink enough water. Let me remind you, for every 30 kilograms of body weight, 1 liter per day. Be sure to use the same shawl, lower it a little, and warm up your kidneys. Warm up your kidneys. It's not so easy to warm them up. It may take you some time and some effort, but I usually warm them up in the evenings for at least an hour so that they get thoroughly warmed, but not too deep. And then your kidneys start to function better and more warmth reaches them for life. You can place it on your lower abdomen to warm up your bladder so that if there are any small stones, they can pass painlessly. And most importantly, guys, if you have bronchial asthma, you need to take the same kind of shawl in the evening and put it under, well, basically under your pants, right? Place it under your feet, rest your feet on it, cover up, wrap yourself up, and warm your feet. By legs, Dr. Golod means the thighs and shins. Thighs and shins, above the knee and below the knee. Let me explain it simply. And this is not just your feet. You need to warm up these parts of your legs until they become warm. And here's a clear instruction. Warm your legs until you start sweating on your legs. I'll say right away, not everyone sweats and not everyone sweats immediately. This process can take some time, but the recovery from bronchial asthma will depend on how well and thoroughly you warm up the organs of the chest and how well and thoroughly you warm up your legs. This is what sets apart what I'm saying from what other pulmonologists say in the treatment of bronchial asthma. And this is precisely the factor that makes it possible to cure bronchial asthma. Singing asthmatics are those who have already thoroughly warmed up their chest. So, let me explain once again. While warming up your chest, you also need to pay attention to warming up your legs in order to eliminate the cause of bronchial asthma. So that was the information for you today. I understand that there are still some things that remain unclear, some points that haven't been fully explained. You can watch this video again. I need you to understand the very principle behind treating autoimmune processes. In other words, we don't just act on the affected organ. We target the system whose dysfunction actually causes the autoimmune process. These are the adrenal glands, these are the kidneys. And both of these organs are connected to having cold feet. Water also plays a role there, but it's secondary. Today the information was about the treatment of bronchial asthma. Friends, I believe that in the next videos here on the channel, I will continue to surprise you with pleasant, wise, useful, and most importantly, interesting information. Stay with me here on the channel. And I will always be with you, Dr. Holod Vladimir Miroslavovich, neurologist. Goodbye, friends.